Hi, I'm Dr. Jane Laline and I'm an international dental business coach, trainer and mentor. Many clients come to me and say, training, coaching, mentoring is the same thing, isn't it? Or they may phrase it differently. What's the difference between coaching, training and mentoring? And I thought I'd make a short video just to explain what are those differences. So first of all, coaching, which I think is the most powerful of the triad. So, as a coach, I'm not here to solve your problems, but I'm here to enable you to find your answers. So, coaching in its purest form is creating client generated solutions. So, a coaching session provides a safe space where you have the security to think, to explore different ideas, time to think, time to reflect, time to come up with your answers. So, as my coach, my job is to really listen to you and hear what you're not saying. It's to help you, it's to ask questions to change your thinking, help you be aware of stuff that you're not aware of. In a coaching session, we're about focusing on future orientation, future orientated solutions. So it's an outcome frame rather than a problem frame, but very much focusing on your future and what you want to create. So as a coach, I'm asking questions. So when you recruit me as a coach, I don't need to know what the answers are. But together, in our coaching partnership, we will find them. And that's very key in a coaching, is that the balance is that we are partners. When I'm training, very, very different presupposition. The presupposition is that actually there's stuff you don't know. You don't know what you don't know. And so my job as a trainer is to teach you stuff. We often joke, and you've probably heard it in many CPD events, about how we're not trained as dentists into business. And although we spend all day, every day with patients, we're often not taught great communication skills. We're taught that we have to convert treatment plans, but we're not taught really patient-centered treatment planning. So if you've never been taught that, it's useful to learn. So if you want to improve the way you communicate with your patients, going on a training program to learn how to do it is a really powerful thing to do. If you want to learn patient-centered sales, learning how to do it so your patients can make the best choices. So as a tutor, as a teacher, as a trainer, what I'm doing is teaching you stuff that you haven't learned so far so that you can move on and be better. And then mentoring, again, is a third presupposition. And I'm not a great fan of mentoring. I do some of it in my coaching sessions. Sometimes clients ask my opinion. But the presupposition of a mentor is that the way I've done it, the way somebody else has done it, is the way you should do it. And actually, I fundamentally don't believe that, because I know that you are unique. You are special. Your values are your values. Your personal circumstances are your personal circumstances. So because you are unique and you are special, that the way somebody else has done something may not be the best way for you to do it. And this particularly comes into career planning. So just because somebody else you know has got BDS and they've moved out of dentistry, the way they've done it may not be the way that you've done it. So it's important that we understand, and this takes us back to coaching, what are your values? What are your beliefs? What are your passions? What's important to you? Because if you're going to be happy in a job, you've got to understand those, and it's less important to do what somebody else has done. So they're the key things: coaching, training, mentoring. Sometimes people ask about consultancy, and I am absolutely not a business consultant. A consultant is somebody who will come into your practice and make an evaluation and tell you what to do. in very much the same way as a consultant might do an examination for you as a patient and give you a prescription, and then you are responsible for following the prescription. And I work with my clients much more closely, much more interactively, and much more supportive relationship. So if you're interested in having some coaching, some training with either you as an individual or you as a team to improve your practice, do give me a ring. My telephone number is 07 989 757 884, or email me jane@iodb.co.uk, and I'm delighted to help you or support you, empower you to take you to where you want to be. I look forward to hearing from you soon. Bye for now.